Hello, Teja. Hello, welcome. We are in the first series. Are you ready?
Yes.
Well, the first series now, it's actually the first conversation of the series of eight. You see, I was looking at the flyer that we sent, and there was your beautiful introduction there. And then today we're talking specifically about introductions, right? Journeys with FND, personal reflections, and what to expect from the series. Do you want me to read your introduction or would you like to introduce yourself? I was thinking that I could do it in that manner. You see how they do it at conferences? Someone introduces the speaker and the guest. Do you want me to do that or do you want to introduce yourself?
I can just introduce myself. Um,
Okay.
my name's Teja. I use she, her pronouns. I've been diagnosed with FND since I was 17 years old, um, and had some other medical conditions prior to that. And I am currently in the UK. I'm from Seattle. I'm getting my master's in pharmacy. I'm hoping to become a neuropharmacologist. Um, and I also work in the young adult community with FND. So I run a support group for young adults with FND and do a lot of some research coordination and some research with FND. And I'm just really passionate about destigmatizing the disorder and raising awareness about it.
Excellent. Thank you, Tisha. Well, we can tell that you're very smart, hardworking by your, and already have many accomplishments, and you like to help people, help others, and contribute to the world. It's a pleasure to be here with you doing this series. And let me tell you, I have many clients, students, patients with FND who I have invited to do this kind of conversations live or record it and put it out there. And there are emotions and thoughts that hold them back. There is nervousness, there is fear of exposure. There are so many emotions and thoughts that prevent them from doing the wonderful work that you have been doing for years because you had your YouTube channel and you have been raising awareness for many years. I'll introduce myself briefly. I am Yadira Velazquez, Dr. Velázquez. I had even functional symptoms when I was in medical school. I think I had 19 years old, and then I got really interested in the nervous system and my own functioning. So eventually, throughout my career as a doctor, as a neurologist, as a clinical neurophysiologist, then I learn more and dedicated my life to it. Now I'm doing mainly education, as you know, and even my programs, they have this educational tone. I wanted, before we continue with the journeys, talking a little bit about the journeys with FND, personal reflections, and what to expect from the eight conversations. I wanted us to set the foundation of what we're doing here because I think it's so important. Um, the way we will be talking and sharing will be paying attention to all the different aspects of the nervous system, all the different aspects of the human organism and life. So it's not going to be a purely cognitive conversation. It's also going to have a little bit of emotions. We're going to pay attention to the body and the sensations that we feel in the body and give voice to the wisdom of the body. Of course, within the body is the autonomic nervous system and pathways and the voluntary sensory motor pathways. We also talk about society, the larger web, and spirituality within that, which goes beyond the social organization of human beings and extends to nature, to our connection to animals, to gods and goddesses and guides and our ancestors. So it will be these kind of four networks that I call it repeatedly: mind, body, emotions, spirit. Uh, so we'll try to touch on those. And I was wondering if we should do a little bit of a check-in with that, Tisha, just for people to see how we will be doing this. And I could even start. You see, it's interesting. I'm very excited, right? My emotions, I'm very excited. But then the body, my physical body, it has I don't know, like my breath, it's arrested. Like there is something happening in my breath that something autonomic that is almost like a little bit short of breath. I'm feeling a little bit of bubbling sensation in my chest and stomach. And then, of course, I take a few deep breaths, I talk about it, and then the energy starts settling. I think the work is very important because we're helping society, we're trying to fulfill our life's mission, and cognitively, I'm curious about what you're going to say.
Um, I think emotionally, I'm feeling like excited and kind of some anticipatory excitement. Um, I'm feeling pretty regulated though. And this morning I noticed a lot of energy when I woke up. Like I was just feeling a lot of energy in my body. And so, because I've been sick the past couple of days, I haven't been exercising, but now I'm feeling much more grounded after I did some cycling. That helped kind of release the energy that was in my body. So right now I'm actually feeling pretty grounded and comfortable in my body, not noticing a lot of really strong physical sensations.
Mm-hmm. And I wanted to check in with the little movement that you're showing us. What would you say that is? Is that grounding, like just touching the earth and exchanging energy with the earth? Or would you say that is a little bit of the bubbly excitement, energy
Yeah, I
that is
think that's residual excitement. Yeah.
okay, nice, nice. And it's interesting how in your check-in with yourself, you showed us the processes of anticipation, right? Like how the mind looks into the future and that causes all sorts of sensations in the body. And you also told us about the past. Oh, this morning. So there is this beautiful connection that we also pay attention to between past, present, and future. We have to pay attention to that in addition to mind, body, emotions, spirit. Excellent. Thank you. So where should we take it next? It was journeys with F&D, personal reflections, and what to expect from the series.
I think maybe I could talk about my story with FND and then we could talk about the eight themes if that works for you.
Okay, go right ahead. So your story, you're going to share your story with F&D. You said, I was diagnosed with 17. Maybe it started a bit earlier. How old are you now, Tasha?
I'm 21.
You're now
Yeah,
20.
so 4 years now.
So tell us a little bit more about it. Especially, I'm curious, have you, in your own reflections, have you discovered the causes? Have you noticed some of the triggers now? Things like that. Mm-hmm.
Absolutely. Yeah, I think it starts well before 17 in terms of like a dysregulated nervous system and things like that. So I've struggled with anxiety since I was a kid and kind of undiagnosed ADHD. And then my freshman year of high school had some significant medical events and spent a lot of time in the hospital. And while I was in the hospital, my freshman year, so I was 15, I was very focused on school, getting to the next thing, just moving on with my life from that. And I wasn't really processing a lot of the kind of scary things that were happening to me at 15 and, like surgery and things like that. I was just so focused on moving on with my life. Um, And I think my body kind of internalized a lot of that fear that I wasn't allowing myself to process. Um, and then COVID happened and I transitioned. Well, actually, before COVID happened, I started to develop some strange symptoms that were kind of concerning, but didn't really raise a lot of concern. So I was passing out a lot. I was like fainting, but I was cleared by a cardiologist. Everything seemed normal besides I was diagnosed with POTS, which is, can be debilitating, but, is not life-threatening, that kind of thing. So I was like, great, it's not something more serious. Wasn't too affected by it. Was having some urinary issues as well. And then all my tests were normal. So we were like, okay, it's just residual stuff from when I was 15. And then I had to be hospitalized again when I was 17 for complications of the medication. Um, and that's when I had what was unclear if the seizure was functional or epileptic, because the reaction I had to my medication could cause epileptic seizures. But I was kind of rushed to the intensive care unit. It was very traumatic. And I think what that experience in retrospect has made me realize is being rehospitalized kind of forced my body to shut down because I was processing all the trauma of being in a hospital at a young age. Um, and Once I got to the ICU, they did an EEG, they did a bunch of blood work, they did a head CT. Everything was coming back reassuring. Went back to the medical floor. They were like, it was an isolated incident. You're good to go home. And then from there, just really struggled with functional seizures. That was the primary debilitating thing I struggled with. I was having at my sickest like 30 a day, some lasting like hours. It was pretty uncontrollable, and there wasn't any resources in my state to help me. Um, so I felt very, very isolated and very, very sick. And my treating hospital actually said they were for attention. So there was a huge element of shame, and misinformation because my entire life was being torn to pieces, right? I was I was on the swim team. I was president of my school's neuroscience club, honor roll student, right? On track to go to college in the next couple of years, and everything was falling to pieces. And I was being told, like, you're doing this for attention, right? So I actually had to be psychiatrically hospitalized, because I was just so in such a bad place. And that I think was kind of an ultimatum or wake up call for my parents that, like, this is not working. And my parents were incredibly supportive throughout this entire process. And they ended up finding a provider out of state. And because it was during COVID, I could do school online and my parents could work online, and we had the financial means to go out of state for a month. So I'm incredibly privileged, and that's where I think FND advocacy comes in, because there's not enough resources for people who can't afford to do that. And there's a shortage of care. But I was privileged enough, and I worked with a provider who I like credit my life to. Like, she absolutely saved my life. And I discharged, or not discharged, it was like an intensive outpatient thing, but I went home about a month and a half later, and I was having seizures every couple of months, but compared to 30 a day, it was a dramatic improvement. Actually achieved 6 months by my senior year, was able to drive again, was captain of my swim team, was able to do swimming again, which was a huge part of my life before FND, and was just able to graduate and go on. And then in college, I again kind of had a relapse where I had been having seizures every once in a while, but I was having a huge increase. So finally, last spring, I took a medical leave of absence, took some time to kind of reset. And I'm doing really well now. I've switched schools to the UK because I found a really good treatment team here. My parents are closer in Europe. And I'm doing really well at my new school. The program is amazing. The school is really supportive. But yeah, it's kind of been a long journey of in and out of, hospitalizations. I've struggled with other functional symptoms outside of FND, like vomiting. But I do think the root cause of it for me was just a lot of unprocessed anxiety and medical trauma, that I was just operating on such a state of high level of anxiety and not allowing myself to feel it or process it, that it that my nervous system became incredibly dysregulated. And of course, I have a lot of organic, quote unquote, organic comorbidities. And when I'm feeling physically sick or physically distressed, that exacerbates my symptoms as well. So I do think there is an element of like physical distress contributing to my symptoms.
Yeah, yeah. You see, you have been sharing for I think it was 5 to 7 minutes, which is kind of a short time compared to many years that you described. So you condensed, I don't know, you're 21, let's say maybe it started, you said when you were a kid, so 10 years, let's say you compressed 10 years from 11 to 21. So you compressed 10 years in 5 to 7 minutes. So what you have shared was big, bigger than what has come across in 7 minutes, bigger than the reality of what we heard, bigger than what we heard. And I want to highlight some really meaningful, serious, important things that you are sharing with the world and honoring that your story is very common because functional disorders are the commonest illnesses affecting the human nervous system. So your story is the commonest medical story that could be affecting so the nervous system. So there are thousands of people or hundreds of thousands of people around the world with that. Now, before I highlight some of the important aspects, let's check in with our bodies for a moment because, yeah, I feel that mind and body working together, united now, making sense of it all. I wonder how did you feel? Making sense of the story, sharing it with the world. Like, how did you feel over there with this important step?
I think currently I feel like almost a sense of release of that anticipation that was before, because this was the part I was most kind of like experiencing anticipatory anxiety for.
Uh-huh.
During, I definitely maybe disconnected from my body a little bit just to kind of focus on being concise and getting the narrative in a way that was accurate and would be meaningful to others, but also authentic to my story. So maybe there was a little bit of cognitive trying to control like the emotional experience of it, and I kind of disconnected from my body a little bit, but I do feel more regulated or calm after saying it, so I don't feel like it was necessarily a bad thing, if that makes sense.
Mm-hmm. Yeah, it's like you're right. We can cognitively disconnect from the physical sensations to get the things done. Uh, but always remembering that, oh, reconnection, connection is what maintains and
Mhm.
brings about health. So if we are spending 30 minutes of mainly cognitive talk, maybe after the talk, then you could do on your own some, or even now, it depends on how you feel, some exercises of tending to the body and tending to some of the emotions that may still be swirling around because even whenever we have a conversation, even that we try to keep it cognitively, in order for the mind to produce the cognitive material, the subconscious, the unconscious needs to provide some of those memories, some of
Mhm.
those sensations, some of those emotions, so the conscious awareness and cognitive pathways can provide a story. So you're like um, swirling around your subconscious. So it's always good to later on see what emotions are there, what sensations, and do a little bit of reassurance, self-soothing. I hear you. Thank you for working together with the mind to provide the story, etc. Yeah, okay. So important things. It's like 7 or 8 points, and I'm just gonna name the the key feature that you mentioned. There is a challenging and traumatic spectrum that we live in. Challenges through childhood, through school, through getting sick, and then even getting some traumas. Everyone, all human beings navigate this challenging traumatic spectrum just because we're alive. So we need to know that this spectrum exists. We need to know how to overcome and what you said, how to process the energy, how not to leave it stuck inside, how to release, how to make sense of it. That's important. You mentioned number two, the role of doctors, providers, physicians, professionals. They can harm, they can cause confusion, they can cause trauma. The medications that they give can have side effects. So doctors have a tremendous role making us sick, worsening us, human beings, or helping us. So doctors need to learn more and they need to listen to patients more because you have tremendous wisdom. Number three, the contradictions between is it organic, is it functional, the symptoms that I'm having, like how do I treat it? Am I going crazy? Is my body truly having an energetic problem, functional problem that needs to be paid attention to that can be improved? The contradictions that are in society, in the medical system, and therefore that the contradictions that are implanted in our body. Functional illnesses are split. So these contradictions contribute to the split. So we have to pay attention to these and find harmony. Number four, medical trauma, when it happens, it needs to be discussed, processed, released, because with that medical trauma still lodged, we go to the hospital and we get re-traumatized. We go to see a new provider and we get dysregulated. So medical trauma is something that all psychologists, all family members, all friends, everyone should get comfortable talking about it so we can process and release. Process and release doesn't only happen in a psychology office. It can happen with a good friend, with a good family member. Huh? When we talk to our friends and we get it out of our chest, that's processing and release. Number five, so important, social services, social resources. This does not exist. Social workers do not know nothing about FND. They are not caring for the FND population. A big problem that we have to bring attention to. Number six, the social priorities between prioritizing our health, medical leave, leave of absence, resting, relaxing, versus focusing our life and society focusing on accomplishing things. What is the reality? Let's put things straight. What is a real priority? Our health or accomplishing things out there? Because sometimes we want to rest, but then the teacher, the parents, the school, everyone is like, no, no, no. It's so confusing. This is such an important point. And lastly, it seems that it is needed. The time to reset, the time to heal, it is needed. Without that, there is no improvement. Wow. Let's take a couple deep breaths and feel realized. Yes. Bring a little bit of ease, a little bit of accomplishment, a little bit of this is making sense and we're making the most out of it and feeling a little bit like a winner, a little bit like in control. of what we're doing and our influence. Okay, we have about 3 to 5 minutes just to keep it to the 30 minutes. What should we talk about in these last 3 to 5 minutes, Teja? What to expect from the series? Do you want me to read the other 7 topics really quickly? And then
Yeah, that'd be great.
maybe you talk a little bit about something around that. So next is going to be facing professional and academic life with FND. Number 3, stigma in the healthcare system. Number 4, social life of a young adult with FND. Number 5, social media and FND, hot topic. Number 6, current care and treatment options. Number 7, reflections on the FND Society meeting. And number 8, goals and aspirations. Good fortune and FND. What do you think about this series?
Yeah, I think the series, the goal is to bring the perspective of a patient for other patients, but also for providers to recognize stigma that exists and the experiences of patients. But I also think it's important for patients to hear from other patients, because so often with FND, people feel really alone in the condition and they don't know how to explain it to loved ones and they don't know anyone with FND. And I wish I had had the community of other young adults with FND when I was diagnosed. So I think that's one of my main goals is as well as bringing awareness within the healthcare community, but also for other patients, because I think when I was diagnosed, I didn't know what it was. I didn't know anyone with it, and I felt very alone in the condition. So didn't know that it was possible to live a quote unquote normal life. And it can be really empowering, at least within the young adult group, to see people who are really struggling make a lot of improvement. That's not to say they don't still struggle and have difficulties. But that's one of the things I want to highlight, is it is possible to recover to some capacity. Of course, you're always going to be navigating kind of regulating your nervous system. And like you were saying, doing check-ins with how your emotion and body are doing, because if you kind of forget to do that, you're at higher risk for symptoms. And I am certainly guilty of getting cocky when I'm not having a lot of symptoms and kind of disconnecting from my body. But it is possible to experience kind of some level of symptom recovery and to do what you want to do, and have a semi-normal social life as a 21-year-old. And that's something I want to highlight to other patients as well.
Yes. Mm, education, right? So we're sharing awareness, and through awareness, we're learning together. So it's education. And I believe knowledge is power. Knowledge can heal. For example, if we have diabetes or high blood pressure, and we learn the foods that we have to avoid, the things that we have to do to get better, if we learn all that, the diabetes may even go away depending on the cause. The high blood pressure may even go away. So knowledge is healing. Knowledge is power. This series is for patients, but it's also for healthcare professionals. It's also for families who have a key role. And it's also for friends and for the healthy adults, because those are also the support network. The ones who make us company, the ones who help us when we're in need. And you said it is possible to live a normal, quote unquote, life. And I want to highlight that what is normal in the 21st century modern world could be sickening, could make us ill. What is considered normal? Some people work 2 and 3 jobs, 16, 18, 20 hours a day. So that could be considered normal to have 2 or 3 jobs, but that makes us sick. So we're challenging also the concept of normal. And we're trying to, through these enlightening conversations derived from personal experience and from neuroscientific knowledge, we're trying to build a new, truly healthy normal because we need it. The world is a little bit confusing. Okay, I think our time is up. Any final words? Should we check with our emotions and our body as a way of saying goodbye to all the parts of our organism that have been supporting the conversation? I can go first. I want to thank everyone who has come across from this video, and I would invite you to share it if you like it, if you find it helpful. I am saying goodbye with tremendous pleasure. I'm feeling very relaxed and calm. My energy has settled. I'm feeling emotionally, I don't even know how to describe it, but very pleasant in a way. It's like calm and pleasant. My mind feels happy too. I'm so grateful for you. How about you?
Yeah, thank you everyone for watching. I really appreciate the space to have these conversations and for people who are interested or affected by FND. Yeah, I'm feeling really grateful and relieved by this conversation and just incredibly grateful for the space that you have provided. Yeah, and physically I'm feeling a little tired and like I need to use my inhaler a little bit. But other than that, I'm feeling pretty relieved. Yeah.
Yes, and that's so normal, right? When we pay attention to our body, the body is like, oh, I need a little bit of rest. I want
Yeah.
to this and that's what brings about health. So I celebrate you from teaching the world how it is to live in integrated function, integrated health that sometimes we forget, but together we can remind one another and we can build new and healthier societies. So happy to do this with you, Tesha, and we'll
Yeah.
be on again in a couple weeks.
Thank you, Dr.
Get some
Velázquez.
good rest. Bye bye. Bye,
Bye.
everyone.